is less timely. We may see, sorry, I got a pop-up notification. We may see less testing on holiday periods. For example, last year we had very low cases reported for Thanksgiving and Christmas, but then especially high cases reported immediately afterwards. So that gap in reporting can be a little bit misleading. So just keep an eye on those numbers, with the caveat that the reporting and the amount of testing really impacts those numbers. And we will, of course, share more information on the new variant as it becomes available. So things you can do, we continue to follow CDC recommendations in terms of masking up. We are all in that high community transmission level, and so the CDC does recommend a mask in public indoor settings. Of course, continue to get tested if you have symptoms, if you're making travel plans, if you want to take extra precaution. Getting vaccinated if you haven't already had the opportunity to do so, and just being aware of the timeline for vaccinations in terms of being ready for the holidays. And of course, continue to follow your local public health guidance in terms of isolation and quarantine. And then I'll share out this link too for the CDC's Safer Way to Celebrate the Holidays. And with that, I'm happy to take any questions. Thank you so much.
Thank you, Erin. I appreciate it very much. I am going to segue directly to Dr. Alex Francisco. He's with the City of Kansas City, Missouri Health Department. So would you mind just filling in here, unique to KCMO? And I think you have some slides as well, and then we'll transition over to Dr. Liang from St. Louis.
Yeah, hello everyone. Yeah, I am Dr. Alex Francisco. I'm the senior scientist and the chief of the Office of Data Dissemination at the Kansas City, Missouri Health Department. So all the data that I present are going to be specific to our jurisdiction. As many of you are probably aware, there's a lot of overlap in the Kansas City area between Jackson County, Platte County, Clay County. So these data are all specific to Kansas City, Missouri's jurisdiction. So that's, excluding everything in the surrounding area where we don't have jurisdiction. So we'll start here with our current case rate. So our current case rate is 142.7 per 100,000, and percent positivity is 8.1%. We had 707 new cases over the last complete week of reporting, and that the first two, the case rate and the percent positivity, land us primarily in the high risk transmission for CDC guidance, which would suggest universal masking is necessary. Breaking that down a little bit further, I wanted to illustrate where those cases are sort of accumulating, and this is a 7-day case rate, so this is over the past week. And you can see here in particular, a majority of the highest case rates are in some of the younger age groups. There is some collection in the 40 to 59-year-olds. Part of this is going to be due to asymptomatic and underreporting in certain age groups, but in schools where transmission, where kids are being exposed fairly regularly to other individuals in close contacts, we do have some higher case rates throughout the city, and that has been a pattern over the last few months. I wanted to illustrate an anticipation of a potential winter surge. So this is the deaths per week, and this is the period from essentially June until present. And the deaths really have tailed off relative to earlier in the year. In our summer surge, we had a peak of about 1,500 cases in a week, and you can see the lag in death for over a few weeks, where we had our peak week of death in early September. But you can see actually the highest number of deaths for the entire pandemic was in August. For Kansas City, we had at least 105 deaths in that month. And so that gives you a decent idea of, the number of cases which then lead to death, at least in Kansas City. If we do see another surge, that is going to be something that is going to be of concern, particularly as it relates to the hospital information that Aaron presented, where we can really quickly overwhelm the hospital staff. So I wanted to illustrate this here as well in the similar context. There actually have been more deaths in Kansas City in 2021 than there were in 2020, with 463 relative to 421. But the age of death has decreased, and that's largely going to be due to some of the vaccination rates that I'll share here in a second. But almost more concerning is that the time from diagnosis to death, or at least first positive test to death, has decreased from about 14 days to about 9.5 days. There's no real scientific basis for why this is. This is just something that I noted in the data, or at least we can speculate, but that's all it would be. And so, just keep in mind that this isn't something that's over, and it's killing younger folks, and younger folks faster. So moving on to our area's vaccination data, I'll break this chart down here. I just wanted to overlay all of the age groups that we have available, so that you can get kind of a sense of the variation in vaccination rates as the age groups increase. So overall in the city right now, we have almost 60% who have initiated vaccination. We have just under 51% who have completed vaccination. But as you can see, that is something that varies widely by age group. And breaking that down a little bit further and highlighting it a little bit more closely, the 5 to 9-year-olds have only had a few weeks here, but we've already vaccinated or started vaccination at least on about 13% of those younger folks. About half of the 10 to 14-year-olds have been eligible for a while, but the other half just gained eligibility. And so we have roughly 37% who've initiated, roughly 27% who've completed. And then moving on to the 15 to 19-year-olds, they actually have higher rates than any of the other ones under 35. So the 15 to 19-year-olds have initiated at about 61% and completed at about 52%. Our lowest age group vaccination, who have had eligibility for months and months and months now, are the 25 to 29-year-olds. So, I present this to keep in mind for your audiences. Your age ranges might differ depending on what your presentations are, but this 25 to 29-year-old age group in Kansas City in particular, at least, has the lowest vaccination rate for those who've had it available, with about 41% who have completed. The tail is completely different for those who are over 35 for the most part. As you can see, these are all above the city averages, and the others were all below the city averages, with the highest group actually exceeding our census estimates of the 70 to 74-year-olds who have completed vaccination at around 98%. Basically, the way that we usually present these data are 35 and over and under 35. Those who are over 35 have a greater than 50-50 shot at being vaccinated, and those who are under 35 are fairly unlikely to be vaccinated. I think that's all of the information that I have. In particular, I think those are the things that I could add above and beyond what Aaron has presented for the region. I see a couple chats here, but I don't know if those are questions. Those just
they aren't, and we'll field that kind of towards the end. I do want, thank you. That is a clear snapshot of the Kansas City region. I now want to move across the state, and I want us to hear from Dr. Stephen Liang. He is affiliated with Washington University, and he has been aiding and supporting the arts organizations in the St. Louis region. So Dr. Liang, it's over to you.
Hi, everyone. It's a real privilege to be here. I want to thank the entire performing arts community for everything that you've done throughout this entire pandemic, everything that you've sacrificed and everything that you continue to do throughout to keep morale and to keep just good spirit throughout the entire community. As far as St. Louis activity, it very much parallels the picture that Aaron and Alex have painted for Kansas City, and that is that we are seeing an uptick in cases. We certainly expect there to be additional uptick following the Thanksgiving holiday, and lots of families gathering in close spaces and so forth. We do worry that there will, like I said, in addition to additional cases, that there will then follow hospitalizations and then deaths after that. That's the typical kind of sequence of events that we see with each of these surges throughout this pandemic thus far. I don't have slides to share directly, but I'm happy to share St. Louis regional information if there are folks who are interested. I do have a scorecard for our region. Kind of just summarizing a little bit about what we're seeing in the hospital, the overwhelming majority of folks who are being hospitalized are those who are still unvaccinated. So it really underscores the importance of vaccination and its protective effects in terms of preventing severe disease requiring hospitalization. We do see breakthrough cases in those who have been vaccinated. Thankfully, most of those are mild. Some of those are severe, requiring hospitalization, and that's usually in a patient population that has multiple medical comorbidities. So our older patients, those with lung diseases, those who would be at risk for bad disease to begin with. So while the vaccines are not perfect, they are doing a lot of great work in terms of protecting the vast majority of those who receive them. As far as kind of the philosophy that we've taken here in St. Louis, working with our multiple performing arts organizations, we've really kind of tried to focus on safe and responsible operations, as well as really remaining highly adaptable to the events. And so we've had a lot of great buy-in among organizations in terms of emphasizing the importance of vaccine. Many have actually required vaccination or proof of vaccination or a test within the preceding 1 to 2 days of a performance. And that's been well received as far as I understand. It's been a real pleasure to work with that entire community. I'm happy to kind of go a little bit further, but I also realize that there are a couple of other panels on this call. I'm happy to answer some additional questions a little bit later on.
Thank you, Doctor. I appreciate it. Just one question I'd like to ask the three of you to address. As we've navigated through the last year and a half, what are some of the first challenges that you've faced, and then some of the top strategies that you have either recommended or seen deployed? Dr. Liang, you have the floor. Why don't you start?
Sure. Absolutely. I think probably the biggest question for many organizations was when to open. And for some of our organizations, some opened relatively soon, so even as early as last October, and then others kind of waited a little bit to see how things panned out. It really depends on the organization's resources as far as being able to space out audiences within the venue itself, as well as the ability to require testing, or even the buy-in to require testing among its audience. Many of these organizations actually polled their patrons to get a general sense of what people would want in terms of returning to a live performance venue. So I think that's really important.
Thank you. Dr. Francisco?
Yeah, echoing Dr. Liang, it's very highly dependent on which organization is actually trying to implement these types of strategies. And so, the summer recommendation was to have as many things outdoors as possible. That's not going to work anymore. And so keeping things as highly ventilated, as spaced out as possible. And then, we, on both sides of the state, have had mixed luck with our mask mandates. So leaving that up to the individual businesses to decide whether or not they can implement those. I have yet to gain access to financial data, but from what I have been able to see, it really hasn't driven down restaurant business or anything like that. At least this most recent round of mask mandates, when we did have one back in August. And so, there's always just going to be this balancing act of concern and safety. And I think that, not much has changed as far as our recommendations go since mid-March 2020, spacing as possible, masking when possible, and sanitizing of surfaces.
Excellent. Aaron, any thoughts? And then I'll field one question out of the chat.
Sure. I'll just add that as kind of a third party who we're really an aggregator and disseminator of information. And I think the way that we were able to add value to the pandemic response in a really meaningful way is just getting people in the same room to agree on messaging and even just wording on how to talk about things and have a more unified message. I think a lot of information that especially came out early in the pandemic, but also throughout, it can be confusing. And people that don't live in this world and look at it every day for their full-time job really have a hard time finding and trusting sources of information. So the more trusted sources that can have a unified message, I think is really where we were able to add value to the response.
Thank you. I will take 2 questions in the chat very quickly. Martin English indicated, would you hope that the Pfizer and Moderna pills would decrease deaths in the new year? Is there any informed speculation about that?
I'll take that one. So, I mean, obviously, there's a really new antivirals that are coming through the pipeline. The question is when they'll actually hit hospitals and we'll actually be able to use them. So we do think that it's a nice additional arrow in the quiver, so to speak, a nice piece in the arsenal. But really, I think that vaccinations do form the kind of the foundation for our strategy to protect the population. But there's no question the antivirals are going to help a lot, particularly in those who are coming to the hospital symptomatic.
Excellent, thank you. Evie Craig asks, is it too soon to assess the impact of boosters or booster shots?
I'm happy to tackle that one as well. So boosters, you may have heard on the news about a good experience in early adopters. So Israel, as well as a couple of other countries, very early on adopted the booster, and their data is actually the foundation for why the CDC made its recommendation about a week or 2 ago, recommending that all eligible U.S. citizens or Americans receive the booster in addition to the 2-dose initial of mRNA vaccine, or in some cases the J&J. So yeah, boosters are going to become, they're going to be widely recommended. They are widely recommended. They do have additional benefits. So yes, I would definitely recommend it.
Super, thank you. I appreciate that. And just kind of, okay, Alex, thank you. You answered the question about the best source of data for the St. Louis area. Thank you. And Dr. Liang, if you have anything else to add, that would be fantastic. So I'm going to ask that you all kind of stay on and be ready to field any more questions, but I do want to transition to arts organizations and to help them or have them share some response and how they have really fortified themselves for reopening and recovery. So I will, because I know Martin English is transitioning off first, and I don't know if Brian Karp is, yes, I see his name. So I'm glad Brian has joined us, but let's transition over to arts organizations. And Martin, I'm going to put you on the spot first, knowing that you have, you're double booked. And I would like for you to kind of dive in and talk to us both about the process of making decisions, safety and COVID related decisions for those you serve. And then also share with us either challenges or advantages, kind of the pros and the cons around what you have in fact implemented.
Sure. Thank you, Dana, and thank you all for organizing this. This is really useful for all of us. For those of you who don't know, we're an arts education nonprofit. And so 60% of what we do is sending teaching artists out into the schools to do arts education programming. And then 40% is arts education classes right here in our own building. So in March 2020, when the lockdown happened, clearly that, all of the teaching artists who were sending out in the schools, that stopped immediately. And then we shut down our own community school, the arts, in this building. As far as a process of how we decided to start making decisions after that happened, fortunately for us, we had some individuals on our board that were willing to step up and be part of what we call our pandemic team and give us advice. One is a VP at Blue Cross Blue Shield. Another one is a medical doctor. Another one is a risk management person at a major local corporation. And so we put together our pandemic team, and none of us could pick up the phone and call others. I can't pick up the phone and call Jeff Bentley and say, hey, Jeff, what did you all do the last time we had a global pandemic? So we were all sort of in the waters, choppy waters by ourselves, doing the best we could. And so it was great to have some board members commit and say, well, look, we're going to give you the best advice we're getting through our experts in the field and what we're doing from a corporate standpoint. So that's kind of how we started off the process of making decisions. We did a lot of if-then scenarios. If community transmission hits this level, then we'll take these actions, et cetera. I would say over the past year, when we started reopening, we weren't one of the first, but we sort of eased our way into it, particularly here in our building, where we started off with smaller class sizes. We had pretty robust protocols based on CDC recommendations for students in schools. So in our building, we continue with our protocols, which are mask in our building, temperature at the door, ask the questions about COVID interaction. We have still smaller class sizes. We've cohorted them. So when we've had a couple over the summer, we had a couple positive COVID cases, we were able to say, okay, that class or that camp is done, you all go quarantine, but we didn't have to shut down the whole operation. So we've been fortunate there. We are still, even when the city raised their mask mandate, we continue with our protocols now because of the chart that we were just looking at, where it was showing that the children are just now getting an opportunity to be vaccinated. So that's been our driving thing for us, is that up until this point, children didn't have an opportunity to protect themselves. So we took it as our duty to keep our protocols robust to protect them.
Thank you, Martin. Looking ahead, what are you focused on in the next 30 to 60 days as perhaps your biggest challenge, and or the challenge that you're seeking information on or about?
Yeah, I think that's an easy question, tough answer. The easy question is for us is, as we're planning for our spring semester, which begins early January, and we have students coming in the building, are we going to stick with our current protocols, or should we stick with our current protocols? Because we're getting to the point now where more of the responsibility shifts to the parents, and they can vaccinate their children or not. And so do we continue with our pretty robust protocols, and what benchmarks should we use? I'll leave that to the medical experts on the call. You tell me, how do I make my decision come January 4, whether I still require masks in my building for our students?
Excellent, thank you. I think I'll follow up at the end with a collection of some of these questions you're posing. So Martin, thank you. I want to appreciate or be cognizant of your time. So I know that you have to roll off early. So thank you for being first. I'm going to shift over to St. Louis, and I'm going to call on Brian Karp to talk about uniquely performing arts in St. Louis. So Brian, same questions to you. Process that you're adhering to right now to make decisions, the provisions that are currently in place. And then last but not least, if you were forecasting and looking ahead at your challenges in the next 30 to 60 days, what are those challenges?
Thank you, Dana. I appreciate that. For us here at the factory, which is one of the newer venues to open, we were under construction during the pandemic. So as everyone else was looking to reopen, we were actually looking to open for the first time. And it gave us a little bit of an advantage where all of our staff that was hired on understood that we were going to require them to be vaccinated to be a part of our team here. So we were able to hire on vaccinated people. We were able to put mask mandates in place. we were able to follow all the St. Louis County guidelines to reopen for us to actually open for the first time. We opened in the middle of July, and there was a couple of weeks where restrictions had fallen off and there were no mandates and any of those things had happened. And then quickly after we opened, after our first couple of events, the Delta variant came on, and we quickly moved to a requirement of either having been vaccinated to attend events or to be tested within 72 hours. We went back and forth a little bit on the 72 hours. We went back and forth a little bit on the PCR versus the antigen test. And what we decided was we needed to not only protect the patrons that were coming in, but we needed to protect our staff members. And because we had staff members that we had brought on that we required to be vaccinated, we felt it was very much important for us to hold the line and make sure that all of the patrons coming in are either vaccinated or tested. So since August 16th, we have had those procedures in place. We've run about 30 shows since then. Our dynamic is a little bit different because we are a for-profit venue, but at the same time, we have one singular owner, Michael Steinberg, who is a large real estate developer here in St. Louis. And he has very much been a proponent of us being safe and being leaders and setting the example for how these venues should operate in the current climate. So for us, it was very important to make sure that we put processes in place that made it as easy as possible for our patrons to find areas to be tested, to find places to be tested, to understand what the requirements were. And we were able to work with staff members that we have that have worked in the industry for years and come up with a process where we have a separate check-in area where people come up. We have either 2 to 8 staff members that are out there. They're checking vaccine cards and negative tests against the ID. And that was something that was very important to me because I've been to other venues in St. Louis, not to name any and none that are on this call today, where they're just looking at your vaccine card and they're not actually making sure that it's you and that it's your vaccine card. Or that it's your negative test. We very quickly decided that we weren't going to take the at-home tests because there was no chain of custody on those. And we've been working with the Missouri Art Safety Alliance to educate our patrons on where they can go get tested, the Grand Center testing facility that was opened up, and different things that we can do to make sure that it's as easy as possible. But one of the things that we noticed very quickly is that it's very much a divided country, and even people that are willing to get vaccinated don't necessarily agree with some of the protocols and procedures that we've put into place. So we always staff either myself or one of our senior managers outside at the tent where we have the check-in. And if anybody gives them any grief or pushes back or just wants to have a conversation, they immediately get moved over to one of our management team so that these line level people that are there are not taking the brunt of people's frustration or anger. A lot of people who say that they didn't see or understand what the requirements were. We're doing refunds on a case-by-case basis. After initially saying we weren't going to provide refunds, we did open up a window at the very beginning of the policy to provide refunds to people. And now everyone understands what the requirement is to attend a show here. Very similar to what's being done at a lot of the other facilities in the area. But even still, you have people that travel from out of state, you have people that travel from small towns. And so it just depends on the genre of the show, and it depends on the attitude of the people at each event as to how many discussions we get into, to put them kindly. As far as moving forward goes, we have that dotted line to a lot of the other large promoters in the country. I speak with people at Live Nation and AEG all the time, as well as the other members of the Missouri Art Safety Alliance. And it's important for us to make sure that we're staying with this policy and holding the line. We don't want to be the first person that says, okay, we're not going to do this anymore. We're not going to require masks. We're not going to require testing. We want to make sure that we're providing this safe space for people to enjoy themselves. And a lot of it is the fact that all of our employees, or the majority of our employees, were out of work for 18 months. And none of us want to go back to that. None of us want to say, okay, everything's fine. And then 6 weeks later to a couple months later, we're all shut down again. So for us, it's about the longevity of the opportunity to be open and to provide these experiences for people to get away from their everyday life, to forget about what's going on outside of our four walls for a couple hours each night. And so how it looks moving forward is a discussion that we have every day. And, the people booking the shows want it to be over now. I want to make sure that we're doing what's safe and appropriate for the current climate. And then, you get the news of the new variants and the different things, and our minds all go to the same place of, oh gosh, are we starting this over again? So we're really hoping that some of these antiviral treatments, some of the things that we can do will help mitigate some of the more serious symptoms and opportunities for people to get sick. But at the same time, I've got 2 small kids at home, only one who is able to now be vaccinated. So it's important for us to, again, maintain that opportunity for our staff to have a safe environment to work in.
Thank you, Brian. I appreciate that. 2 things. One, I continue to hear this balance between, really aiming and prioritizing the safety of staff and volunteers, and not wanting to, not move ahead in generating new revenues. So that seems to be an ongoing challenge and balance throughout. I think I want to transition very quickly to Emily Frankowski. She's the director of Connect to Culture. She kind of represents the non-metro areas, and I'd love to give her the floor. I'm seeing if I can locate her. Emily, are you on the call?
Yep, I'm here.
Okay, super. Oh, there you are. Oh, excellent. So Emily, same question, really process in what you've implemented, and then really looking ahead.
Yeah, so with Connect to Culture, we're a very unique organization in the fact that we are the community arts agency, somewhat of an arts council figure for the Joplin area, which is located in Southwest Missouri. But we are supporting and promoting all of the arts and cultural organizations, of which there are 40 plus, through a variety of resources online and offline. And as well, we are a performing arts presenter. We bring in national touring shows on a yearly basis. Of course, with COVID, it made it quite difficult. And not like Brian, we're not opening our building yet, but we are currently building a new performing and visual arts center called the Harry M. Cornell Arts and Entertainment Complex that we will be opening late next year. So hopefully by then we're looking in a much brighter spot. But for our process, it was very similar to Martin. We had ours was called a COVID, and still is called a COVID-19 task force within our board, made up of health professionals as well as business professionals and some city staff. So we really pulled them together and leaned on them to give us great advice on what to do, what kind of protocols to put in place. We were lucky that our season in 2019-2020 ended in March 2020, a week before the city shut down. So luckily we didn't have to cancel any of our performances, but we created this COVID-19 task force. And we also tried to provide leadership for all of the other arts and cultural organizations in the Joplin area. We put together a survey that garnered over 500 different individual responses in February of this year to also help guide us to figure out, are people comfortable going back to performances, indoors, outdoors, how large of venues? Are they going to be put off by having to wear a mask or social distance or anything like that? At that time, we weren't really talking about vaccinations. So hopefully we will probably be doing that survey again in February of the next year. But we used all of this to kind of give us the best information to move forward. We had a lot of outdoor performances that were really well attended. We just started our performances for this new season in September. And in Southwest Missouri, having requirements for vaccinations and or testing, it was very off-putting to my board members. So we are more of the mind of encouraging mask wearing. We have all staff, all volunteers wearing masks. We have hand sanitizer stations. Anyone dealing with any of the artists are masked. Artists are always masked as well. But that's kind of what our provisions are right now. For one specific performance coming up in February, we will be, joining our friends in St. Louis and Kansas City and requiring vaccination card or 72 hours of a negative test because we have jazz great Charles McPherson, who's a Joplin native, coming in. He's 83 years old. And our committee decided we really need to protect him. And that was per his request. And we wanted to honor that. So we are going to give that a go. We do plan to hire either off the clock police or a security service to help us enforce that, because we cannot count on we can't rely on our volunteers for that. We don't want to put them in that kind of a place. We do rely on volunteers to help us out. So we're going to give that a go. But it has been a challenge with our first performance of this year, which is in September, just a couple weeks ago. It was a children's performance. It was Schoolhouse Rock Live, and we did purposely have 2 performances so we could sell, we wouldn't, completely sell out, because the hall was about 1,100 seat. We did not have anywhere near that amount. There was plenty of space to spread out. I would not say the majority of people were masked, but there were people that were masked. But that really did provide a safe opportunity for kids to go and enjoy live performing arts. And it was a joy to see. Another thing that we've put into place is that we are requiring anyone who buys at the door to pay $5 extra. So it's kind of an incentive to buy early, and so that we can limit that contact with our patrons and try to keep them safe. Another thing that's kind of difficult for us is that since we don't have our own theater, we do rely on different venues in town, and everyone has their own way of cleaning. So it's very difficult, but we're working closely with all venues, which, one is the high school, one is a college, another is a church. So it's a lot to keep track of, but we're doing our best to really communicate effectively with those venues to make sure we keep all patrons safe.
Fantastic. Thank you, Emily. I want to, come back to the west side of the state and call on Rashida Phillips to share with us, the same information. Rashida is unique because she not only leads a museum setting, but also a public gathering and the Blue Room, a music venue. So Rashida, if you wouldn't mind, process. I know you've given this considerable thought, provisions you have in place, looking at both venues, and then ultimately what's front of mind for the next 30 to 60 days.
Yeah, thank you so much for having me this afternoon. We actually have 3 venues. We have the Gym Theater, that's a 500-seat theater across the street as well. So we're hybrid, hybrid. No worries. We're a hybrid institution with quite a bit going on here in the 18th and Vine neighborhood of Kansas City. We've maintained a steady pace of requiring masks. We're a little different because we're sort of city aligned, right? We're in a city space, and so we're always sort of checking in with the city to see what those particular protocols are, as well as checking in with the health department to make sure that we're on task there. I can say that we have a strong partnership with University Health, which is formerly Truman Medical. So they are a wonderful representative and partner with us. So we're always providing up-to-date information and testing if needed, et cetera. Our neighbor here is the Negro League Baseball Museum. And so they also share our main facility space, and we stay in step with them. And I mention that because they've certainly run a few vaccination clinics over the past year or so. And so we continue, me and Bob Kendrick, who runs that institution, we continue to stay in step with each other and, encourage folks to be vaccinated and provide those opportunities for folks to be vaccinated. That being said, we've polled our staff. We're about 80% of vaccination rate within our staff at the moment. Right now, we are not requiring it. We're a little small in our staff. We've got 12 full-time, 22 part-time employees. But as you mentioned, it's an interesting environment here. Our museum, we haven't had really any major problems with our public. They've been pretty gracious with us. Our museum, we continue to stay pretty spaced out. I think at this point, everyone realizes what social distancing is. is very respectful of each other. So they continue to sort of go through the museum and tour and wear their masks and keep some distance. The most challenging spaces continue to be a little bit of the Blue Room, which is our working jazz club. We're open 3 to 4 days a week there in the evenings. And I say challenging because it's a working bar. And so people are drinking in that space. And when they're reminded that when they're not drinking, they'll put their mask back on. So we certainly remind them of that from the stage itself and certainly have that up on our screens. The gym theater is also interesting. We have a lot of folks who actually rent that space and produce events out of there because we're not always utilizing that space full time. And so we have to really work with those partners to make sure that their provisions are in place in terms of utilizing face masks, the hand sanitizing stations, carrying the insurance, et cetera. I think it's interesting for us. We continue to keep an eye on the variant. We continue to have really strong staff and board conversations. I can say that I'm really proud of my staff. I've got a really trustworthy staff. And what I mean by that is that they're self-reporting every day. And they have come to us at moments and said, hey, I'm not feeling well, or hey, I've come up positive. And we've taken the proper precautions to let them stay off site for 10 days. With the pandemic, we were able to really create a rhythm with each other to work virtually if needed. And so we've continued that practice, at least with our staff, to work 3 days on site and 2 days off site. That way we're kind of scaffolding that staffing schedule to make sure that folks are not all crowded with each other at the same time, that there are opportunities to spread across our campus and work in different spaces, as we've done some renovations to our space to really spread out and sometimes be isolated if needed. And be able to collaborate virtually if needed. And so some of this, we could go further. We'll keep an eye on that variant. We continue to kind of poll our colleagues here in the Kansas City area. KC Culture Cares is a wonderful initiative among many of our institutions and cultural spaces that came about during the pandemic, where we really reach out to each other and kind of ask these questions. What are you doing in terms of mandating vaccinations? What are you doing in terms of new protocols regarding the mask? So we're really pretty cautious and really receptive, I think, to learning from others, even as our peer institutions differ in size, right? Some of them are massive and some of them are smaller like us. But I can say, as I continue to say throughout this pandemic, folks have banded together. That's the one thing I think that is pretty key, that we are all really doing the best that we can. And as we serve, babies up until elders, we are really conscientious too of those particular audiences and putting them in spaces where they are allowed to either space out, or we are allowed to require vaccinations if needed, if we do have artists that require that on our stages.
Thank you, Rashida. I appreciate your insights. I think collectively we're hearing a lot about masking. There is a fairly broad representation as it relates to whether people require vaccine proof or not, social distancing. I want to throw a question back to the health officials. As we and as our industry moves ahead across state, what are kind of the top three? Well, first, what are the top data indicators that we need to be paying attention to as we make our decisions within our organizations? What do we really need to be focusing on? And then secondly, reiterate, I know, but what are the top three strategies that have proven out to be the most impactful through this process? So first, what data do we really need to be paying attention to? And then the provisions moving ahead. And I'll toss that to Dr. Francisco and then Dr. Leong and Aaron as we move ahead.
Yeah, so really the points that I made sure to illustrate are 7-day case rate and a 7-day percent positivity. So those are going to be the best two indicators for a snapshot. And those are available in a lot of places, but the CDC website has those broken down for almost every jurisdiction you would want to find. And you won't even have to read the numbers or interpret them. Like Aaron showed, it'll show you a specific color that will indicate those data. So following those data are really going to be the best way to know what the risk level is in your area. And it can get really nuanced because it's hard to compare. Jackson County is right next to Cass County, but Jackson County has a population density almost 100 times higher than Cass County. So they're really hard to compare if you're just looking at the raw numbers. So those case rates and those percent positivity rates are going to be your best option there. And as far as mitigation strategies go, it's our job to advocate for vaccination. So that's going to be number one. You really can't do better than vaccination. And so starting there, making sure that you're vaccinated, your employees are vaccinated, your employees' families are vaccinated, everybody who's eligible. And then beyond that, at a certain point as an individual, it comes down to your own risk tolerance, whether or not you're willing to go out in public and eat in public, and taking into consideration your own health and your age and everything along those lines, and who you can spread it to in particular. Keeping all of those things in mind, as an individual at least, those are the types of strategies that you can use to prevent. I try not to come into contact with people that I don't know. Try to stay 6 feet away from anybody that I don't really know very well. And so beyond vaccination, it really does fall onto masking, social distancing, and probably sanitizing and hand washing in that order.
Thank you. Dr. Leong?
Yeah, I think Alex hit the nail on the head as far as, the case rate and the positivity. And really, at this point in the pandemic, we're 2 years in from the first cases that first arose in Asia. And really now we have a lot in our armamentarium with vaccines, antivirals. We know a lot more about the disease, and it really has now come down to kind of risk tolerance as well as responsibility. Your responsibility to yourself, your family, your community. So the importance of masking, vaccination, distancing, just responsible operations. So yes.
Thank you. Aaron, any additional thoughts?
I echo everything that's been said. Absolutely agree. I put that link again to the CDC site in the chat. I think that's a really valuable resource. And then the only thing I think I would have to add is more of a mitigation measure promotion effort in terms of, I'm so glad to hear so many are requiring masks. I think we tend to undervalue the power of social norming and seeing other people around you wearing masks, and how walking into a room and being the only person on masks.
I think Aaron has frozen, at least for me. I just want to reiterate what she's saying. People do tend to adopt the norms of those around. And so I will just attest to Arts KC, we are still masking in our office, even though we have a small team. And I think it is a responsible thing to do. So what I would like to do is, first and foremost, invite questions in the chat if you have them, but I do want to transition over to Michael Donovan. As Rashida mentioned earlier, our communities have banded together. We have made cohorts where we could lean on one another and really learn from one another. And Michael Donovan and the Missouri Arts Council did just that and created a program called Arts Safe to help us all better implement policy and navigate staying safe and the recovery. So Michael Donovan, I don't see you, but I would like to turn it over to you to talk a little bit about Arts Safe. Meanwhile, if you do have questions, put them in the chat, and we will field as many as we can at the end of the program. So Michael, over to you.
Thank you, Dana. It's interesting that when we started planning this webinar just a few weeks ago, we didn't know we were on the brink of yet another shift in the scope of this global pandemic. And while the sector has shown some incredible resilience, it's in persistence in the face, I can't help but note that this has affected our art, our community impact, and the very lives of creatives and our audiences. So it's very satisfying to be part of this conversation. and to hear some of the real science and the real information that we need to hear to survive and thrive in this. As Dana mentioned, the Missouri Arts Safety Alliance has been meeting regularly, weekly to bi-weekly for a year and a half now. In July 2020, we started Missouri Arts Safe to train arts groups and creative businesses on how to create safely, present safely, and attend safely. And since then, over 1,300 people have taken the training, and over 175 organizations are certified, with more still applying weekly. And we know that audiences feel concerned about the pandemic, that they're looking for businesses and organizations that take their safety and concerns to heart. We recognize the safety of artists is the essence of producing art for the public. So we've learned a lot in this last year about protocols, about relative risk, and more about epidemiology that we'd ever hoped to learn, and see how the protocols have changed and how groups are moving more towards the essentials of masking and social distancing, depending less on some of those early protocols that require taking temperatures, but more on identifying symptoms. Contact tracing was very uneven across the state, and so that was affecting things. But we've benefited from this easy access to vaccines, and the many groups that have, especially in Kansas City and St. Louis, mandated vaccinations or testing for the audiences, volunteers, and artists. This has made a lot more performances happen, frankly, than would have happened otherwise, I believe. And while there's no consensus on how long this will go on, clearly we've got a moving target. At the Missouri Arts Council, we've been adapting as well. We had been doing our board meetings virtually and had planned to meet in person last month when it became very clear that it was too soon to go to live meetings. The National Poetry Out Loud program that we do for the National Endowment for the Arts we've been told that it's going to be a virtual competition nationally, and we're going to align with that for the state competition in the spring. So we continue to try to focus on minimizing the risk of exposure to our applicants and our staff. So here's some of the suggestions that we have based on what we've observed on the groups that are operating in Missouri, especially the ones that are state certified. Clearly, organizations continue to maintain appropriate protocols based on your venue and the type of programs you do. We recognize that there's pressure, a lot of pressure to diminish your precautions. And you noted that one of the groups in St. Louis in particular, there are 13 of the larger cultural institutions that elected together at the same time on the same day to announce that they were going to require mandates for vaccinations or testing, recent testing. It helped to do it with the strength of the group and to strengthen the long-term credibility of the arts. We recommend that you communicate with your audience and supporters to ensure that they're not feeling abandoned to you at a time when you may not be in front of them as often. Certify Missouri Arts Safe still, if you haven't already done so. Use the training for new staff, people who've been trained several months ago or almost a year ago. Remember, there's only 9 minutes, it covers a lot of circumstances, and that training is still available, even if you choose not to certify. Use the logo to identify your certification and it links back to MissouriArtsSafe.org so that we can promote all the groups meeting the standard, and adapt your protocols as necessary. Strengthening whatever is important so that it remains viable for your organization. Make sure that your protocols, if you change them, maintain that same link so that it doesn't break the link to MissouriArtsSafe.org. Compare your plans to other organizations. And we'll continue to use the experts locally and nationally to inform our protocols and recommendations. And feel free to contact us for support and advice, and we'll refer you if we need to. These are challenging times for the arts, the likes of which we've never seen. And your continued existence as an organization is a testimony to your creativity and viability as an organization. I want to thank you for all you do to make the arts happen in Missouri.
Thank you, Michael. I appreciate it. We have no additional questions in the chat. There is some conversation about attendance, of which I've read, and it sounds like attendance is certainly coming back, even with the precautions and provisions that people are putting into place. So, Michael, thank you for the resources that you've provided, and both the Arts Safe Alliance and Arts Safe certification and all the information that's incumbent of that. I want to thank everyone who both attended but also participated. Rashida Phillips, Dr. Alex Francisco, Emily Frankowski, Brian Karp, Martin English, Mike Parker, Aaron Caldwell, Michael Donovan, of course, Dr. Stephen Liang. I want to thank all of you for giving over your time and your intelligence to the arts community. I also want to encourage my colleagues, the arts industry and artists and arts org leaders, do not hesitate to reach out to resources. I know that Mid-America Regional Council, the Kansas City, Missouri Health Department, and Dr. Liang have all been generous with their time and their efforts in supporting not only our industry, but our communities overall. So thank you for your time. And that concludes our webinar for today.